Podcast 5 of the Thorax series, the Mediastinum. This podcast is going to detail the contents and the boundaries of the mediastinum, including the superior and inferior parts. The mediastinum is a centrally positioned space within the thorax. Its boundaries are the two pleural cavities laterally, the superior thoracic aperture superiorly, the diaphragm inferiorly, the sternum anteriorly, and the vertebral column posteriorly. The mediastinum itself is not a structure, but is a space that contains numerous important organs, vessels, and nerves. These include the heart and great vessels, the trachea and esophagus, and also the vagus and phrenic nerves and part of the lymphatic system. So the mediastinum can be divided into a superior and inferior part by an imaginary line drawn horizontally through the fourth thoracic vertebra and the sternal angle. This is the transverse thoracic plane. The superior mediastinum is found between this plane and the superior thoracic aperture, whilst the inferior mediastinum is found between this plane and the diaphragm. The inferior mediastinum can be further subdivided into anterior, middle, and posterior parts, with each part containing a specific set of structures. So let's go through each of the four parts and detail their contents, starting with the superior mediastinum. The superior mediastinum contains the thymus gland most anteriorly, which in the adult is mostly a fatty connective tissue structure. Lying posterior to the thymus gland are the great vessels, and these include the right and left brachiocephalic veins, which unite to form the superior vena cava, and posterior to these is the aortic arch, which gives rise to the brachiocephalic trunk, the left common carotid artery, and also the left subclavian arteries. All of these vessels ascend through the superior mediastinum and lie anterior to the trachea. The trachea descends through the superior mediastinum from the larynx and gives rise to the left and right primary bronchi at the level of the sternal angle. Posterior to the trachea is the esophagus, and this passes into the superior mediastinum as a continuation of the pharynx and lies anterior to the vertebral bodies of the thoracic vertebrae. Also found within the superior mediastinum are a series of important nerves. These are the two phrenic nerves, the two vagus nerves, and their associated recurrent laryngeal nerves. The right phrenic nerve enters the superior mediastinum by passing to the right of the right brachiocephalic vein and superior vena cava. It then descends towards the diaphragm by passing anterior to the right lung root. The left phrenic nerve enters the superior mediastinum by passing between the right common carotid and right subclavian arteries, and then descends to the left of the aortic arch and passes anterior to the left lung root. The phrenic nerves deliver motor information to the diaphragm, as well as receiving sensory information from the diaphragm, the pericardium, and parts of the parietal pleura. The main autonomic nerves of the thoracic viscera, the vagus nerves, enter the thorax posterior to the left or right brachiocephalic veins. The right vagus nerve lies anterior to the right subclavian, and at this point gives off the right recurrent laryngeal nerve. This nerve hooks under the right subclavian, then ascend between the trachea and esophagus to innervate the larynx. The right vagus nerve then descends through the superior mediastinum, lateral to the trachea, and runs posterior to the lung root. The left vagus nerve descends posterior to the left common carotid artery and enters the superior mediastinum between the left common carotid and the left subclavian arteries. As it descends through the superior mediastinum, it lies to the left of the aortic arch and then curves medially to run alongside the esophagus. As the left vagus nerve passes the ligamentum arteriosum, which, if you remember, connects the pulmonary trunk to the arch of the aorta, it gives off the left recurrent laryngeal nerve. The left recurrent laryngeal nerve hooks under the aortic arch, lateral to the ligamentum arteriosum and ascends through the superior mediastinum in a groove between the trachea and the esophagus to innervate the larynx. So the vagus nerves give off the recurrent laryngeal nerves. The right recurrent laryngeal nerve is a branch of the right vagus as it passes the subclavian artery, whilst the left vagus nerve gives off the left recurrent laryngeal nerve as it passes the aortic arch. The orientation of the vagus nerves posterior to the lung roots and the phrenic nerves anterior to the lung roots is an important feature lying lateral to the middle mediastinum, and you should use this arrangement to help you identify these nerves. So now let's turn to the inferior mediastinum, which can be divided into the anterior, middle and posterior parts, with the posterior part being the most complicated. So let's just mention the anterior and middle parts briefly. The anterior mediastinum is the smallest of the three inferior parts and is located between the heart and the sternum. The anterior mediastinum contains the remnant of the thymus gland, which regressed into the superior mediastinum at puberty, and in the adult, this just contains some fatty connective tissue. The middle mediastinum, which is directly posterior to the anterior mediastinum, only contains the heart and its pericardium, and I'll detail the heart and its pericardium in the next podcast, number 6. So the most complicated part of the inferior mediastinum is its posterior portion. The posterior mediastinum extends from the 5th thoracic vertebrae to the diaphragm, and it therefore doesn't contain the trachea, as this is already bifurcated. But it does contain the descending aorta and the esophagus. Also it contains the azygous system of veins and the thoracic duct. Descending through the posterior mediastinum, as a continuation of the aortic arch, is the thoracic aorta. As it descends, it courses medially from the left side of the 5th thoracic vertebra to enter the abdomen through the aortic hiatus of the diaphragm, and this occurs at the level of the 12th thoracic vertebra. As it passes through the diaphragm, the thoracic aorta becomes the abdominal aorta. Coming off the thoracic aorta are 3 groups of vessels. Anteriorly, there are the unpaired esophageal branches, which supply the esophagus. Emerging laterally are the paired bronchial arteries, which supply the bronchi. And emerging postolaterally are the paired posterior intercostal arteries, and these run along the costal groove in the intercostal space. Also descending through the posterior mediastinum is the esophagus, and this emerges from the superior mediastinum, posterior and to the right of the aortic arch. As it descends alongside the thoracic aorta, it passes to the left and enters the abdomen through the esophageal hiatus, and this occurs at the level of the 10th thoracic vertebra. At this point, the esophagus is now anterior to the thoracic aorta. Along its path, the esophagus sits directly posterior to the left atrium and the base of the heart. Positioned most posteriorly in the posterior mediastinum is the azygous system of veins. These veins run superiorly against the vertebral bodies of the thoracic vertebra. The azygous system contains the azygous vein, the hemiazygous vein, and the accessory hemiazygous vein. The azygous vein is derived from the right lumbar veins, which drain the posterior abdominal wall, and is the most prominent vein in this system. It provides a collateral pathway between the inferior and superior vena cava. As it ascends along the vertebral bodies, it drains venous blood from the posterior thoracic wall on the right-hand side. It also drains blood from the esophagus and the bronchi, and drains into the superior vena cava by arching over the right lung root. Lying to the left of the azygous vein is the hemiazygous and accessory hemiazygous veins. The hemiazygous vein is a continuation of the left lumbar veins and ascends against the thoracic vertebra, receiving the 9th to 12th left posterior intercostal veins. This crosses the midline to join the azygous vein at the level of the 9th thoracic vertebrae. The accessory hemiazygous vein receives the 4th to 8th left posterior intercostal veins, and also crosses the midline to join the azygos vein at the level of the 7th or the 8th thoracic vertebrae. The remaining 1st, 2nd and 3rd left posterior intercostal veins drain into the superior intercostal vein, and this vein drains directly into the left brachiocephalic vein. The largest lymphatic vessel in the body, which is the thoracic duct, also lies within the posterior mediastinum, and this is positioned in between the esophagus and the azygos system of veins. It drains all the body's lymph except for the right arm, right chest and right side of the head and neck. It drains into the left brachiocephalic vein, emptying the lymph into the systemic circulation. Sometimes the sympathetic trunks, which run along the lateral border of the thoracic vertebrae, are described as being part of the posterior mediastinum. But I won't detail these structures here, as in podcast 9 of the thorax series, I give details about the autonomic and somatic nerves of the thorax. So I'll end this podcast by reminding you that the mediastinum is split into superior and inferior parts, with the inferior mediastinum further divided into anterior, middle and posterior parts. In the next podcast, number 6, I'm going to discuss the heart and its pericardium.